Oh man, no lights? Yo, it's a good thing I have this emergency kit. Got a flashlight.
Yeah?
Radio.
Yeah?
Water.
Yeah, whatever, man.
Non-perishable goods. A bucket, rope.
Whatever.
I even got batteries for the kids' games. Yo, I'm glad I planned ahead. How about you?
Yeah, man. I can stay here.
This message is brought to you by the Department of Health.
Good afternoon, Bermuda. Today, for the coronavirus briefing, I'm joined by the Ministers of Health, Minister of National Security, and the Minister of Education to provide families and students with information. Information so that we can govern our lives, so that you can ensure that your rights as employees are protected and that you can manage your businesses, and most importantly, so that we can safely spend quality time with family and loved ones. To begin, we will have an update from the Minister of Health, who will provide the latest statistics and further advice from the Ministry of Health to minimize the chance of any new outbreaks of the coronavirus. Minister?
Good afternoon, everyone. Today there were 808 test results received by the Ministry of Health, and none were positive for COVID-19. Bermuda has had 159 confirmed in total positive cases, and their status is as follows. 145 have fully recovered, and there are 5 active cases who are all under active public health monitoring. None are hospitalized or in critical care, and the total deceased remains at 9. The average age of all of our confirmed positive cases is 59, and the age range of all of our positive cases is from 18 to 101 years of age. Overall, 54% of all cases are black, 42% are white, and 4% are other or unknown. The source of all local cases is as follows. 55 are imported, 85 are local transmission with known contact, 19 are local transmission with an unknown contact, and none are under investigation. Bermuda's country status remains at sporadic cases, and the 7-day average of our real-time reproduction number is less than 1. Between the 13th of July and the 10th of August, 1,869 residents have arrived in Bermuda via commercial flights, 970 of whom had a pre-departure test. We have also had 2,463 visitor arrivals, and 2,349 of whom all had pre-departure tests. The gap in visitors' pre-test is because when the borders first opened, the pre-departure test requirements were not enforced to allow for a transition window. Since it became a legal requirement, there have been few cases of visitors arriving on island without their negative test results, although in such of those cases, they did receive their test results shortly after arrival. Compliance is very close to 100%, and further measures are being taken to enforce this fully with visitors. I really want to encourage residents that are returning to the island to have a pre-departure test before traveling. Although it is not legally required for you to do so, it provides an added layer of public health protection and also means that you do not need to quarantine. You are free to roam as soon as you get your results from your arrival test. Currently, residents without a pre-test have to quarantine until they receive the results of their day 4 test. This can take 24 hours, so in reality, they must quarantine for 5 days and may only leave their home to attend to PROT's Traveling Testing Center for their scheduled day 4 test. The government is currently reviewing the policy regarding residents without pre-departure tests, as there are serious concerns that 12 of the 13 imported cases have been residents, and a majority of the positive cases did not have pre-departure tests. Also, I must reiterate that all residents must have a travel authorization in order to travel, and that all returning residents must comply with the testing regime and public health monitoring for 14 days when returning to the island. The only exceptions regarding testing are children under the age of 9 and below. Yes, this may be an inconvenience, and the Ministry of Health has tried to minimize inconveniences as much as possible, but we must remember we are in the midst of a pandemic which claims lives, and we must never forget this. Saving lives and having a healthy community must be at the forefront of all of our decisions, from the governmental level down to our individual daily choices. I briefly want to touch on returning to work guidance if you are working in a high exposure risk setting, as this has changed slightly this week based on consultation with Bermuda's physician community. This guidance applies to workers with close, sustained contact with the public and includes institutional settings, for example, care homes, patient care settings, corrections, and health professionals. Our travel policy recommendations is that employees in these settings should not return to their physical workplace until they receive their day 14 test results. The rationale for this is that they work in high-risk settings with vulnerable persons and could risk causing a dangerous outbreak. Sometimes it is possible to work remotely through telemedicine. However, if the healthcare worker is considered essential to providing critical healthcare services and waiting a 14-day test result is not possible, the following standards may be applied at the discretion of the workplace managers, who must assume responsibility for compliance monitoring and for the outcomes. They must have negative test results from their arrival, day 4, and day 8 tests before returning to high-risk exposure work. The healthcare worker must also complete the final COVID-19 PCR day 14 test. They should practice workplace isolation until day 14 test results are received. The healthcare worker must wear a surgical mask at all times unless a higher level of PPE is required for healthcare procedures being undertaken. They must complete daily self-monitoring and documentation of temperature and symptoms for 14 days after arrival. They must complete all subsequent testing according to the traveler guidance and must maintain physical distancing and hand hygiene. They should inform their patients and the office staff of their travel history and quarantine process in advance of returning to the healthcare setting so that informed decisions can be made by patients and coworkers for their own health protection. When I say essential, I mean that this is a direct healthcare service which is critical to the health and well-being of the community and Bermuda, and where no other local providers are available. This is slightly different guidance for visiting specialists who are providing healthcare services or technical assistance not available from other physicians in Bermuda and which are critical to the health and well-being of the community. And they must adhere to the following. The healthcare worker must complete COVID-19 PCR testing as per the Quarantine COVID-19 number 3 Order 2020. They must have 2 negative COVID-19 test results, which is a pre-departure and arrival test, or the arrival and the day 4 test results before returning to high-risk exposed work. The healthcare worker must wear a surgical mask at all times unless higher level of PPE is required for healthcare procedures being undertaken. They must complete daily self-monitoring and documentation of temperature and symptoms for 14 days after arrival. They must practice workplace isolation until day 14 test results are received. When I say workplace isolation, this means that staff should wear surgical or procedural masks and any additional PPE based on usual routine practices, and wear the PPE at all times in the workplace, and this is acute care and non-acute care, not just during the client care. The healthcare worker must also travel in private vehicle, work is only one facility, and self-isolate at home when outside of the workplace. The healthcare worker must not eat meals in shared spaces in the facility, as they will have to remove the PPE to eat. Before I close this evening, I just want to remind parents and summer camp organizers, schools, and daycares of the requirements for children entering these settings following travel abroad. In order for a child 9 years or younger to enter a summer camp or school following travel abroad, their parents or guardians who traveled with them must have 3 consecutive negative tests. For a child 10 years and older, they must have themselves 3 negative tests. This will be either a pre-departure test, an arrival test and day 4 test, or an arrival test, day 4 test, and day 8 test. And this includes children of visitors and residents. This also extends to staff members who have also traveled. They must have 3 consecutive negative tests to return to work. Summer camps, schools, and daycare are classified as medium risk settings and therefore should follow the advice listed on the coronavirus@gov.bm website under the guidance notes, Safe Return to Work After Travel. I end by reiterating that, in fact, residents should be restricting their travel to only essential business. This is not the time to take holidays or go on shopping trips. The risk is far too high, and it would surely be a terrible burden to live with if one were the cause of Bermuda to have local transmission once again. Our testing regime protects us, but it is not perfect. Testing is a point-in-time snapshot, and it is possible to be undetected and asymptomatic. So please limit your travel to essential travel only. Shop locally and shop Bermuda, and if you must travel, quarantine as is required under the public health laws, and they will help to keep you, your loved ones, and our community safe. Thank you.
Thank you very much, Minister of Health. We will now hear from the Minister of National Security with an update from her ministry, which I think, Minister, includes good news for local cricket fans. Minister?
Good evening, Bermuda. I wish to start by sharing a few points about the large group guidelines. I would like to announce that the Cabinet gave consideration to increase the group assembly size from 50 to 75 persons. As such, in accordance with the Public Health Regulations, Section 53A, group sizes will start at 75 persons. This will be effective Monday, August the 17th, 2020. Additionally, I'd like to make mention of cricket. The Cabinet has discussed the weekly cricket games, and we are pleased with their adherence to the rules and their strict physical distancing practices, and we will be increasing that number from 250 attendees to 325 attendees. However, there are conditions for gatherings such as these that are priority and must be adhered to ensure the health and safety of our community. Risk mitigation measures, the location and amount of persons who are likely to attend any event, cleaning regimes, and physical distance measures should be included in any email or request. The ministry will review your requests and will obligate itself to follow up with you for clarity if needed. Switching to something I touched on last week, hurricane season. You have seen the local weather updates about the latest system circulating in the Atlantic, Tropical Storm Josephine. Our midday update indicated that Tropical Storm Josephine is around 700 miles east of the Caribbean islands, approximately 1,600 miles from Bermuda. The Bermuda Weather Service and the United States National Hurricane Center are monitoring the progress of this storm. According to weather forecasts, Tropical Storm Josephine isn't currently expected to form into a hurricane within the next 5 days. But should this storm pose a threat to Bermuda, the Emergency Measures Organization will meet, and following that meeting, we will provide a public update. The community can follow the storm's projected path by visiting www.weather.bm. As a reminder, we are in the middle of an active and potentially troublesome hurricane season. The public can be assured that against the backdrop of the COVID-19 pandemic, the Ministry of National Security and the EMO have assessed the government's contingency and emergency plans to ensure that Bermuda is properly prepared. However, We cannot become complacent, and residents need to do their part to make sure they're adequately ready. Now is the time to make sure your hurricane plan is complete. A change to the usual hurricane kit should be the addition of personal protective equipment, PPE, for you and your family. This includes face masks or face coverings and hand sanitizer. There should be enough PPE to last for 7 days for each member of your household. And just some general reminders. Make sure you have at least 7 days of food supply for your family and pets. Make sure you have ample supplies of non-perishable goods, prescription medications, fully stocked first aid kits, fresh batteries, and smartphone battery packs, flashlights, and any other items to aid in an emergency. Make sure you carry out routine activities like making the necessary repairs around your home, such as fixing shutters and blinds, trimming back overhanging trees or shrubs, and ensuring your home or marine vessel insurance is up to date. These activities can assist greatly in ensuring minimum damage and financial costs in the event of a severe storm or hurricane. Turning to the matter of COVID-19 guidelines for commercial or tour boats, I want to stress that while individuals are on the water, they must adhere to the rules and guidelines in place. Here are some key updates for commercial boating. Commercial tour boats. Marine and ports have adjusted their licensing capacity for carrying persons to ensure that they take into account physical distancing. Liquor licensing. Commercial and tour vessels are governed by the rules that cover all liquor licensing establishments, meaning they can only serve alcohol between 8 a.m. and 12 midnight. For recreational vessels, raft-ups are allowed, and so is staying out on a boat overnight. And of course, physical distancing and mask guidance applies to all on land or sea. I encourage everyone, if at any time you see any breaches of the COVID-19 guidelines on land or water, please call 211. Finally, as I end my comments today, I wish to extend my thanks and appreciation to the individuals who make up the Gang Violence Reduction Team, led by Pastor Leroy Bean. This pandemic and its resulting social, health, and economic challenges have meant that we have had to have the right support in place to support our people. In that regard, the Gang Violence Reduction Team has been hard at work over the past few months providing an invaluable service. And their contribution to keeping our communities and at-risk young people safe and protected during this pandemic must be publicly acknowledged. The Gang Violence Reduction Team has coordinated support for several families, and they work with those persons who are in need of food, support, court support, and social and unemployment assistance where required. And throughout the shelter in place, curfew, and other emergency measures, the Gang Violence Reduction Team continued to visit targeted neighborhoods, building upon the connections and relationships with our at-risk young people. More specifically, the Coordinated Crisis Response Unit, CCR, was activated to support the community through emotional hardship. The public may recall that the unit was set up to assist family members, relatives, or witnesses of violent incidents through times of crisis. The CCR unit was deployed to the hospital and also made visits to support families affected by violence several times during this pandemic period. The CCR unit has systems, structures, and trained staff in place to provide immediate emotional support to the affected families in order to connect them with long-term support through counseling services and support groups. In order to lower community tensions, the Gang Violence Reduction Team further increased its focus on street-level outreach. The outreach workers have been in our community directly, meditating tensions and conflicts between individuals and groups. This is high-touch, highly confidential, and very sensitive work. It involves directly working with persons who are currently involved or have been directly impacted by gang violence. The goal is to steer these young men towards pro-social activities by providing a range of opportunities for change. Also, during this pandemic, the Gang Violence Reduction Team has been conducting increased check-ins with high school and primary school students who were previously in prevention programs. They have been coordinating with the school's management teams and connecting with youth and families through WhatsApp calls, Zoom calls, small group sessions, and home visits where necessary. They will continue to provide critical support as the school term resumes next month. Quite simply, the work of the Gang Violence Reduction Team is immeasurable and necessary. And as essential workers who have been working throughout this pandemic, our community owes the Gang Violence Reduction Team a debt of gratitude for persevering against the odds to ensure that we have safe and peaceful neighborhoods. Thank you.
Thank you, Minister Ming, and I echo your sentiments of the great and continued work being done by Pastor Bean and the Gang Violence Reduction Team. Now we will hear from the Minister of Education, Minister Diallo Rebane, who will update the public on the plan to reopen our schools in September. Minister Rebane.
Thank you, Premier. Good evening, Bermuda. There are now 26 days leading up to the start of the 2020-21 school year, and we look forward to having our students and staff return to our schools. All school staff will return on September 1st, and our students will return on September 9th. The only students and staff who will not return to school buildings are those staff and students who meet the Department of Health's criteria for the extremely clinically vulnerable as verified by a doctor or physician. I also want to inform parents that all students under the age of 16 years old will be on site in school buildings every day during the school week. This includes students from the preschool level up to S2 in the senior school level. For clarity, there will be no rotating in and out of school buildings for students from preschool to S2. Separate plans for S3 and S4 students who will be attending classes at their respective senior schools, the Bermuda College, or who are on work-study programs are awaiting approval. The 2020-21 school year will bring a new and different experience for our staff and our students with the added safety measures required for schools and with some revisions on how teaching, learning, and services will take place. I can reassure Bermuda that as we prepare to reopen of schools, technical officers in the Department of Education, school principals, staff, and administrators have been and continue to work steadily to move plans forward for the reopening of our public schools on September 1st. It is critically important that that school opening plannings involve our union partners. Now that we have entry-exit guidelines in the final stages, the Commissioner and the BUT will be meeting at least once per week as we move towards school openings. Additionally, input will be sought from our other union partners, the BPSU and the BIU, as we continue to collaborate with them. The hybrid learning model. In my previous statements, I shared that in September, we will follow a hybrid learning model for our students. That model includes the following scenarios. 1, students who are in school buildings will be taught by their teachers who are also in the school buildings. 2, students who are in the school buildings may be taught remotely by their teacher if the teacher is extremely clinically vulnerable. In this instance, a teacher will be on site in the building to support the students. And 3, students who are extremely clinically vulnerable and who must be shielded will access learning remotely at the same time as their class under the supervision of a parent or guardian during set periods of time. Health and safety protocols and measures. During the Zoom town hall meetings held by the department recently, Parents wanted information on class sizes. The Department of Health has set guidelines for class sizes of a capacity of up to a maximum of 18 students where possible, with a minimum 3-foot social distancing in classrooms. The classroom size for preschools has been set at a maximum of 10 students. The guidelines for class sizes are to be supported with the following safety measures. Staff and students must remain at home if they are not well. Daily screening procedures at each school, which consist of taking the temperatures of staff and students and responding to COVID-19 related questions. Ensure proper room ventilation so air is circulating. Ongoing student hand washing. Respiratory etiquette for staff and students. Mask wearing for all students during the entry and exit procedures. Middle and senior school students throughout the day. Adults throughout the day. Any movement around the school, and environmental sanitation or cleaning. Information shared with parents. The Commission of Education has been hosting a series of meetings to inform parents of plans for the new school year and the reopening of school buildings. 10 Zoom town hall meetings have been held to date, with 2 sessions held for each school level: preschool, primary, middle, senior, and Dame Marjorie Bean Hope Academy. The meetings were streamed live on Facebook, and the recordings are available to be watched in their respective school-level Facebook pages. Officers in the Department of Education, along with the Department of Health officials, emphasized 3 priorities during these meetings. 1, staff and student safety and health. 2, staff and student wellness. And 3, teaching, learning, and student services. These sessions focus mainly on the safety and health protocols for schools. The Department of Health officers who were present explained safety measures to mitigate and eliminate the risks from COVID-19. The Department of Education officers also explained the specifics of the entry to exit safety and health protocols, the concept of student bubbles, and class sizes. Additionally, they discussed the criteria for the extremely clinically vulnerable and what parents could do to prepare students who have asthma for the return to school. Department of Education officers shared information about the hybrid learning model and the work that is being carried out by technical officers in the preparation for the reopening of our schools. Some parents have indicated that they would like to keep their children at home for remote learning regardless of their health conditions. I must emphasize that this is not the purpose of the hybrid learning model. The model was developed to accommodate students who are extremely clinically vulnerable and must be shielded and who must remain home. Our student health records indicate that this would be a very small percentage of our student population, and the success of the model is dependent on only having a small percentage of our students access learning remotely. A teacher teaching remotely will teach the students in the classroom and the students who are extremely clinically vulnerable at the same time. A teacher will not be able to manage large numbers of students remotely in this scenario. That will place additional burden on our teachers. We must keep the number of students learning remotely only to the extremely clinically vulnerable students to protect the health and well-being of our teachers and to ensure that effective learning occurs within the classroom. Power School and Parent Connect. The Power School system is a critical part of the Department of Education's communication infrastructure. We want parents to know that Power School is your source of accurate, contact, and other parent details for administrative purposes, and for keeping track of your children's progress in school. Therefore, parents are reminded that they must have a Power School parent account in order to have access to the Power School parent portal. An examination of our data for parent account shows that too many parents do not have a Power School account, or they have not accessed their account. If parents do not know how to access the Power School parent portal, or if they are unsure if they have an account, they can reset their password using the following steps: going to classroom.powerschool.com, choose the Forget Password link, enter the Power School's ID, your email address, and press Send Request. New parents or parents will be contacted and provided with instructions on how the Power School parent portal can be set up. If you have questions regarding your account or any difficulties, please email powerschool@moed.bm. Any parent that does not have an account and has a child within the system can email powerschool.moed.bm as well to obtain an account. Information on account setup is located on the Department of Education's Facebook page, Bermuda Public Schools, and on the Ministry of Education website, which is www.moed.bm. Transportation and bus schedule and safety. Officers in the Department of Education and the Department of Transportation are working on a schedule and procedures for student bus transportation. Parents will be advised as soon as this plan has been finalized, which we expect to be completed soon. Department of Education meetings with school staff. Separate meetings for school staff are currently being arranged for the week of August 17th, 2020. School staff have been sent information on the dates for each school level meeting. Although the meetings are not mandatory, I encourage staff to participate so that questions that they have about school opening can be answered. Lastly, there's been much concern expressed about school uniforms. Let me first say that individual schools are responsible for deciding on their school uniform. As a result, the Commissioner has reached out to all school leaders and asked that they work with their respective PTAs before the opening of school to find ways to help parents in need to secure uniforms for our students. Our objective is that every student will have a set of uniforms for the school year. We do know, however, that some school leaders have already implemented strategies to help parents. Additionally, there have been requests from parents to consider simplifying uniforms at the primary, middle, and senior levels. Given this, we have asked our school principals to engage with PTA presidents and parents in conversations at the start of the school year about the school uniform and how it may be simplified moving forward. Earlier today, during a meeting with the chairman of the board and principal of Cedar Bridge Academy, we discussed the topic of uniforms. I'm pleased to report that they have already begun to mobilize efforts in regarding a revised uniform policy for the upcoming school year. I'm confident that all other school leaders will look at similar measures to assist our parents as it relates to school uniforms. There is no doubt that we will have to adjust our new normal. There will be minor teething issues that will be experienced as we open schools. I want our parents, teachers, principals, and education staff and our students to know that there's been a tremendous amount of planning that has gone into ensuring our schools are safe to open. I wish to take this time to thank all those who have spent countless days over the last 3+ months poring over the data to develop our guidelines and to ensure safety when our schools reopen. Thank you, Premier.
Thank you, Minister of Education. We have certainly seen news stories about countries that haven't been as strict as Bermuda has been and are witnessing challenges when it comes to the reopening of our schools. However, in Bermuda, we have been diligent, and we have not had a confirmed case of local transmission in 54 days. And I'm confident that we will provide a safe environment for our children come this September. For just a few minutes, I'd like to speak about our collective management of the pandemic and where we are today, Thursday, the 13th of August. The United States Centers for Disease Control and Prevention have erroneously placed Bermuda in a country category that does not reflect the reality of our coronavirus management. This government is working with international public health agencies, Government House, and the U.S. Council General to change Bermuda's listing, especially since the World Health Organization has us listed as sporadic cases, and we have been globally recognized for being one of the leaders in coronavirus management. We will continue to address this listing, which has real implications for our tourism industry, as the US CDC rating can impact other countries' ratings and also different measures in various states. And the U.S. Council General has informed me that we are making progress in revising this listing, and we expect to have good news to report next week. It may seem like many moons ago, but we declared a policy of social distancing on the 12th of March. I remember that day because we could not forecast what would happen, and we couldn't anticipate its impact on us, our people who made our history by being wide open to the world. Then, in mid-April, we announced that based upon scientific advice and our pandemic modeling, Bermuda's worst-case scenario was 700 deaths. That number and the potential of 700 deaths was the defining moment of this pandemic. We were told that we may lose hundreds of Bermudians, and we were determined then and there that we would do all that we can to prevent that from happening. Thankfully, with more information, the worst-case scenario has now been revised lower, but it still predicts, in a worst-case scenario, over 200 deaths. Now, why did I take us back there? Because as we move to reopen our country even more, as we seek to adjust and thrive again, there are reports that some people are not being as vigilant as is necessary. Some Bermudians are getting on public transportation and taking their masks off. I received a plea from the bus drivers this week, imploring me to remind persons at our weekly press conference, to remind the public, for everyone's safety, to keep your mask on while riding public transportation. It cannot be stated more clearly. If you are on public transportation, you must wear your mask. Some people, without concern for their own well-being, are risking the health of others by not wearing their mask properly in places where they are required to do so, such as indoors or outdoors where you're unable to socially distance. Wearing your mask properly means that your mouth and nose are completely covered. We have seen recently where countries are reversing protocols they use to open up. We are hearing phrases like second waves, and countries that thought they had rid themselves of the coronavirus are beginning to see a rise in infections. I urge everyone to take a look at New Zealand, a country which was acclaimed the world over in their handling of the coronavirus. They went 102 days without local transmission, and overnight they have a fresh outbreak, and their capital city of Auckland is now back on a 3-day lockdown, which may be extended. That must serve as an example to all of us, that as good as it seems right now, this virus can resurge. Now is not the time to be complacent, or we risk a setback that can affect our economy, affect our children's education, and affect our collective health. So I'm asking each and every resident in Bermuda and each and every person who leaves their homes to please ensure you follow the simple protocols that we have become so used to. Simple: washing the hands or sanitizing them and wearing your mask. This is the only way that we will avoid the fate that has befallen other jurisdictions. Understand, if there are 1 or 2 isolated cases, but we are taking those preventative measures, it will reduce the risk of spread. What happened in New Zealand is they had abandoned the policy because they had thought that they had eliminated the virus, and they were not wearing masks in public spaces, and we can see how quickly this virus, which can transmit itself so fast, can resurge. That is the reason why we must continue to maintain the strict policies of which we have laid out, and it is the only way that we will be successful. Our healthcare workers at the airport are awesome and serving with composure and poise. Our hospitality staff must continue to be observant, and our church services will soon combine praise and fellowship as before. Bermuda, it is very simple. We have come too far to not remain cautious, and we must do our jobs to make sure that we keep the progress up. I remain encouraged by the emails that I receive from local entrepreneurs who are working hard to keep their businesses moving forward by changing how they operate and fully catering to their clients and customers. One such organization is Bermuda Water Sports, a small business that operates at Somerset Bridge and has been in existence for 30 years. They are showing innovation and commitment to Bermuda. This company is eager to collaborate and be involved in the promotion of Bermuda's tourism product, and I welcome and encourage others to join me as we promote and reshape Bermuda as a tourism destination. In a meeting with the chair of the Bermuda Tourism Authority earlier this week, I implored that the work that we did in testing and adhering to rules be highlighted in our marketing to potential visitors. Sadly, in Bermuda, or historically in Bermuda, we like to adapt an attitude of we're beautiful, we're wonderful, come and visit us, versus what is necessary to ensure that people actually come, which is aggressive selling and making sure that we share our success to potential visitors. It is my expectation that that change and message was received by the leadership of the Bermuda Tourism Authority, and it will be reflected, as the only way that we will be successful is if we tell people the Bermuda story and how well we have collectively worked to manage this pandemic. The same attitude that applies to tourism must also be applied to the selling and marketing of Bermuda as a business jurisdiction. The Business Development Agency has been told to sell Bermuda aggressively and to leverage our pandemic management. And I have to say that this aggressive posture of which we've taken in international press is bearing fruit. We do know that over 100 persons have applied for residential certificates. We have been engaging with companies that are looking to relocate their staff, and we have won out over other islands due to our close proximity to New York City and our safe environment for the leadership of a technology company that is moving out of New York. Our country must seize the opportunity that our collective work has created. And I want to remind all of us that it is our job collectively as persons who love Bermuda to sell our country, whether it's tourism or whether it's in business. So I'm encouraged by those on social media who will share the message with their friends, whether on LinkedIn or in other places, letting the world know the good job of what we're doing in Bermuda so that message can be spread. This technology company that the leadership is relocating here saw a post on LinkedIn, and it was because someone was sharing the post. So it is important that we tell our own story, and that is the way that collectively we can make sure that we rebuild our economy. Yesterday, the country received good economic news that Standard & Poor's affirmed Bermuda's debt ratings and our debt outlook. This is important as it is independent validation of our country's economic performance, especially during a time of a pandemic. Yes, our economy is challenged, and yes, there are persons who are losing their jobs and persons who have lost their jobs. However, we must continue to remain united as a country. The Economic Advisory Council has made a number of recommendations, many of which have been progressed. And the Economic Development Committee of Cabinet is meeting on Monday to consider further recommendations. Many economic measures which can provide stimulus to the economy are being pushed forward and advanced quickly. So, for instance, we have a long process for approval of certain items, and those long processes for approval are being condensed. Why is that? Because we need to make sure we advance shovel-ready projects and other matters to completion to make sure that we can provide economic opportunity. We'll see stimulus in the area of green energy projects, of where we're working with a number of partners to complete the projects which are on the table, and also in the area of infrastructure development, of which we've seen announcements from the Ministry of Public Works. There will be further announcements in the matter of infrastructure and broadening our economy while reducing red tape, and this is important. While we spoke about the work that the Business Development Agency is doing to recruit additional companies to Bermuda, I'm also pleased to report that on the FinTech hat, we are soon to see additional licensing completions under the Bermuda platform. And this is certainly encouraging news for the country, as this is a long-term bet and investment that this government has made, and it is slowly but surely paying dividends as we expected it to do. I would like to make sure that I encourage persons to take advantage to learn more about these opportunities and take advantage of the free online education that has been offered by the government of Bermuda, and those courses are located on Bermuda's FinTech website, fintech.bm. The free online education programs are designed to meet the needs of all sectors in the community, irrespective of your individual experience level. Participants enrolled in the FinTech school will have access to a bundle of courses that are self-paced and range from Blockchain 101 to AI in FinTech, intro to startups, and much more. I also have to say that what is also critically important is that we remember, as certain companies are moving virtual. I spoke to a company that is in the fintech space yesterday, where we had visited when we took a delegation to Mexico, and they had informed us that they had closed their office and have now moved to a fully virtual platform. And he reached out to me to find out whether or not there were persons in Bermuda whom they could extend employment opportunities for working virtually. So it's important that we remember and recognize that as the world is changing during this pandemic period, there are opportunities that can exist, but it is only if we take the time to make sure that we upgrade our training. Again, that free training is available on fintech.bm, and the online courses are available up until October. So please take advantage of those opportunities. Before I close and take questions from the media, I would like to pause and acknowledge the work of the media. Over the months of the pandemic, at a time when Bermudans were unsure, anxious, sheltering in place, and needed to have quality information, the media, each of you, distributed information quickly, often with compassion and clarity. And for that service to Bermuda, I thank you. I'm happy to now take questions from those members of the media.
Well, thank you. Afternoon, everyone. Jonathan Bell from the Gazette. Mr. Premier, I speak for us all here. You mentioned this technology company. Can anything more you can tell us about that and other companies of this kind that might be looking to actually relocate their leadership here from New York, other places?
Here's the simple fact, Jonathan. The fact is that where we are right now with our successful management of this virus, we have opportunities. Bermuda is uniquely located as it is in close proximity to the major centers in the Northeast, such as New York. And even though New York has fared better than other jurisdictions, New York is certainly challenged when it comes to the fact that it is a dense place and dense population, of course, getting around on the trains, and there is opportunity for spread of infections. A lot of offices have not opened up. A lot of companies are remaining virtual, but as we know during the lockdown period, that is a very difficult thing for a person's mental health. And companies who are especially in the growth phase, who are looking to do things, want to have their businesses, their employees together in one place. As I stated, a gentleman had contacted us. He had been looking at a number of other jurisdictions. We, under the leadership of the Minister for the Cabinet Office, who assists me on economic development matters, a message was sent to us on Cut Match Thursday. It was sent to LinkedIn to Minister Hayward. Minister Hayward sent that message to me. I sent that message to Minister Wayne Ferbert. The Monday after Cut Match, we were able to convene a full panel from the Business Development Agency and support agencies in the country. We had our conversation and discussion. There was a follow-up from the Business Development Agency, and yesterday he informed us that he will be coming to Bermuda next month and looking to relocate members of his staff here following the successful introduction. So I'm not going to disclose the name of the company, but what I can say is that there are many other engagements that are taking place just like that, because we have done a good job of managing this virus. So when you look at the people in Silicon Valley who are literally unable to go back to their offices, when you look at the places where they are closing and going completely virtual, this is an opportunity. And that's why I'm making sure that I remind all Bermudians that it is responsible for all of us to commit to selling the country. Sharing our success on social media will only help us gain gain the exposure of which we need for there to be more and more opportunities such as this.
Thank you, sir. Piggybacking on that, I guess, I've done some stories lately of just look at the expatriate workers that are leaving the island. And you know, back in the recession times, we were hearing that our economic health and the numbers of people that we had on the island somewhat went hand in hand. I guess with these numbers of people leaving, we don't really know where our population, what the actual figure of it is. Can you walk us through how that's going to dovetail with the plans for economic recovery that we've got underway?
Certainly, any reduction in persons who are working inside of an economy will certainly lead to a weaker economy, and that's what we will see. The Minister of Labor laid out the figures that exist, the fact that there was still a significant amount of persons who were collecting unemployment benefits from the government who were looking to transition to longer-term assistance. But our job as a country is not to, to sulk. Our job is not to say, woe is us. Our job is to say that we all have to work together to make the situation better. So the government has moved quickly, has accepted advice where advice has come, has said, yes, we can move on this. Yes, we're going to act on this quickly. Yes, we're going to push these individual items forward. And the only way that we're going to recover is if we continue to be aggressive. So I had a good call with some hoteliers yesterday, and some hoteliers now are for the first time seeing new bookings outpacing cancellations. This means that we are certainly turning the corner. But the only thing I would say, Jonathan, is that imagine how much of a worse shape our economy would be in if we did not take the stances in which we did, if we didn't follow the public health advice led by the Minister of Health and her team, if we did not adhere to the strict guidelines which were set out, and get ourselves to this pandemic period so that we could safely open our economy. So we're in a better place than we were before. The fact that I given when I was here last week, Thursday, that we were able to, with a successful reopening of the airport, have 919 more tourism jobs or people return back to work as a result of that. That is the true success of what it is that we're doing collectively as a country. And I have to continue repeating that it is us collectively as a country. It is not necessarily about parties, it's not necessarily about the government or opposition, it's about what we're all doing, all the citizens of this country, playing their part to make sure that we can rebuild our economy strongly.
Thanks, sir. A couple of political ones here, sir. I'm sure you're very sick of people asking you if there's going to be a snap election. However, we haven't heard from the Progressive Labor Party who their candidate is for Smiths North. I believe I have that right, Smiths North. To the backdrop of that thought that is on many of people's minds, is there an election coming up soon? Why haven't we heard who's going to be running there yet?
Thank you, Jonathan. As you would know, I think that the last time that there was a by-election, I think that there was a certain amount of stories in the press and media regarding our internal candidate selection process. Unfortunately, this was a resignation by a member of the One Bermuda Alliance. I think that they knew that there was going to be a resignation, and they had a candidate that was already lined up. We have an internal process that we have to follow, and I'm not going to short-circuit that internal process. We had a meeting of our party's central committee. There was a notice which was sent out for persons who are interested in standing for that seat. We aim to make sure that we can announce a candidate for that seat next week. A by-election has to be held by October 3rd, and a by-election will be held before October 3rd.
Gotcha, sir. Okay, my CDC question has been answered. Yeah. So going to your letter to the opposition leader, who at least on TV seemed baffled by it, and he made reference to the hotel association letter that had you annoyed. Why didn't you just WhatsApp the opposition leader with that communication to him?
I sent an email to the opposition leader. But I think that it's important to recognize that the unfortunate situation, what happens when you enter into a by-election, is that things become political. And we would have seen last week a number of various attacks from the opposition on the government at a time when I have been trying to be a very good bipartisan premier for this country and making sure that I operate in a spirit of unity. And so there were 2 consecutive weeks. The opposition leader, as I said, made a very distinct statement in his press conference in where he said that he was expecting there to be additional resignations. And we did not have our weekly call. I have set aside time for a weekly call with the opposition leader. We did not have that call, and I had made sure that I sent that letter to him. But as we've seen in certain cases and instances, I wanted to make sure that I was being completely fair and transparent. I don't play political games and leaking and all the rest, and I was just going to make sure I was fair and transparent with all persons in the country.
Thank you for that, sir. Ms. Wilson, a couple of health ones for you. We've had the returning resident, yes, who tested negative and then later tested positive. Obviously, kudos to them for complying. If they hadn't complied, that would be a different kind of situation. Where are we at with, in terms of keeping track of people and making the bracelets, for example, making absolutely sure that there's no chance that somebody can deliberately or inadvertently become one of these super spreaders that we're hearing about before they know they're positive?
Thank you, Jonathan, for that question. That is critically important. As was perhaps mentioned previously, I believe the issue concerning the monitoring is actually, because it's an enforcement issue, does come under national security, so I will revert to my colleague. However, we have used the bracelets on 2 particular individuals. However, we recognize that those persons were both positive, and we used it for tracking them, but we have such a high level of compliance for persons that are positive. The decision now has been to look at exploring the use of the monitoring on persons that are going to be quarantined.
Gotcha, thanks. And finally, yes, 4 weeks back, Minister, we had a resident returning from Atlanta, and this person went to work ahead of their test results. And we heard this week the ministry was cooperating with police. Can you confirm what information, what details, the person's name or their workplace actually went to police?
I don't have all that information in front of me. I actually did contact Chief Inspector Weeks myself at the time of the infraction and when we became aware of this. However, I can say in furtherance to that the Epidemiology and Surveillance Unit, as well as in conjunction with the police, we've decided that given the circumstances of that particular case and that the case management as well as the investigation are such that there's no further action that warrants any type of further action with respect to that. Based on the circumstances, we're talking about a teenager that has been publicly shamed, so to speak, and the more important issue, I think, is the fact that the public can hopefully take a message that, we are obviously concerned about ensuring that people are adhering to the requirements to quarantine, and we've had no episodes of such breaches to our knowledge since that date.
I believe that's me. Thank you.
Good evening. We are seeing long lines at the testing centers for visitors and arriving residents getting their 4 tests. Setting aside recent arrivals, do you believe that we are still testing widely enough within the population to ensure the virus isn't hiding in our community?
Thank you for that. We have tested over 30,000 people to date, which is quite a large accomplishment for an island and jurisdiction of this size. With respect to the lines that you're speaking about, ever since the introduction of the PROTS testing facility last week, which is simply for travelers, if you've been referred by your physician, or you just want to have a pop-up test because you're an essential service worker, and we're encouraging those persons within the essential services industry to continue to voluntarily seek testing. Those can be obtained at the pop-up testing sites as well as at Southside. But the PROTS is simply for travelers. That's a traveler's clinic, so to speak. And the lines, though they may appear long, we've seen such a reduction in the lines for the testing since the opening of the PROTS. I think of important note also is the importance of surveillance. Our critical area with respect to ensuring that we are safeguarding it is our borders. If we can ensure that we have proper surveillance at the borders so that we can prevent COVID from entering, then that will help to minimize the impact of COVID. And with the testing regime that we've heard us speaking about previously concerning the pre-departure test requirement for all visitors, as well as the considerations that the cabinet is undergoing now in terms of what, if any, further testing will be required for locals that are also returning to home. So the reality is that the surveillance is key, and that over 30,000 persons have already been tested thus far. So I don't think I would necessarily agree with you that we're not testing sufficiently. However, I would say that with the introduction of the PROTS post office testing site for all travelers, the wait time has been drastically reduced.
Just to follow up that, but within the local population, do you think we're testing enough?
Yes, I do. The point of trying to, and I have to emphasize this again, so forgive me for repeating this, but the surveillance is key, and the reality is that our biggest risk is our borders, people entering. You've seen in the last several weeks that the entrance of that we effectively had no transmission prior to our opening the borders. We have seen a few cases that have come in. However, they've been identified because surveillance is so tight. So yes, it is a challenge with respect to the border opening. However, that challenge has been mitigated because of our surveillance efforts and our testing efforts.
Okay. Thank you very much.
And if I can just say one thing, Don, the minister's team has done an excellent job in adjusting to this. And the fact is, we are more and more successful in promoting our jurisdiction as a safe and viable tourist destination, there is going to be more and more stress and pressure that is going to be placed upon the minister and the testing teams. But they've done an amazing job. The labs have done an amazing job in keeping up with the demand, and I think that we should all be proud of what it is that we've accomplished. I think it's also important to note that even though you see those big numbers, the fact is that I think our community testing levels, as the minister said, they've kept up these pop-up sites, have remained the same, and I would encourage persons to continue to make sure they get that testing.
Thank you.
John, let me just add also, we've extended the hours to PROT's post office as well, so that we can ensure that we are accommodating all of the visitors that are coming, the travelers that require testing. And we've received overwhelming compliments from persons that are standing in line, waiting. It's an organized manner. It's the facility itself is a very, very nice facility. There's ample shade. There's a water station, et cetera, for persons that are waiting. And the reviews, I'd invite you to visit down there. I mean, I can meet you down there one day and just let you see, because it's an absolutely stellar performance. And I'm just pleased that the ministry and the team at the ministry were able to put that up and running in very short order.
Okay, thank you, and I'll take you up on that offer.
Okay, definitely.
Are you concerned that with longer wait times that locals who might go and get tested now won't bother because they don't want to go through the hassle of waiting for hours, as the scheduled appointment times don't seem to be followed due to the long waits?
Again, I'd have to disagree with you with respect to that, because now that we have opened up the PROT's testing facility for the travelers, the wait times have been drastically reduced. Also, because of public health monitoring, persons are receiving email alerts as well as calls to remind them of their need to take tests. And the enforcement mechanisms also include for persons that are required to take their day 4 and their day 14 tests, they may have a knock on the door from the police if they don't show up. So if persons are concerned about wait times, I would invite them to reconsider that, because they do need to have their tests. They certainly don't want to be on the wrong side of the law with respect to not appearing, but at the same time, again, we've had high degrees of compliance, and the wait time has been drastically reduced with the introduction of the PROT's post office testing site.
Thank you. We now know that children can catch and spread this virus sometimes more efficiently than adults. Health Minister, last week you said that the policy on arriving children being tested at the airport would be reviewed. Schools are about to reopen. What is the government's policy on testing kids and their households being quarantined after a family member flies back and before these children return to school?
Okay. Well, first of all, I would have to disagree with you with respect to the fact that children seem to have catch the spread of the virus quicker than adults. The evidence doesn't support that. And I would like to refer you again to the release that I just gave a little while ago, insofar as the requirements of children that are over the age of 10, requiring to have 3 tests prior to entering, and as well as the circumstances that I outlined with respect to their parents. So they would follow what their parents are doing as well if they're a minor. I'm sorry, if they're under the age of 9, excuse me. However, the evidence does suggest that the adolescents and young adults have the same level of transmission as adults. But again, as I indicated in the statement, if you're traveling back with your guardian or your parent and you are under the age of 9, there's no requirement for the 3 negative tests. But if you're over 10 or above, then you will be required to have the test before you can enter either the schools or a setting such as the summer camp and so forth.
Thank you. Either for the health minister or the education minister, when schools return, will rotating staff specialists such as IT, art, and substitute teachers be allowed to be at more than one school, or will a protocol be put in place such as the nursing homes limiting them to one facility?
Dawn, thank you for that question, because it is something that is being looked at. Currently, the Department of Health is helping us come up with protocols for the peripatetic staff that we do have within our schools. That would be the staff that you just described, school counselors. They go in and out of schools, adaptive PE teachers, educational therapists, and the like. And so protocols are being developed specifically for them. Also, protocols are being developed for substitute teachers if they are needed within a school bubble.
Thank you very much.
Can I just add to that, Don?
Yes.
Obviously, at this point, because we have no community spread and we don't have that particular scenario, at this point in time, the specialists will be allowed to, and the educational therapists will be allowed to visit one school per week to work one-on-one with the students. Of course, as the Minister of Education indicated, there will be the requirement for them, as well as the students, to wear proper PPE. And this is being monitored, because in the event that we potentially have community spread, but I'm hopeful that we're not because of all the protocols that we've put in place, then that situation will have to change.
Okay, thank you. Mr. Premier, you mentioned earlier, you talked about this a little bit earlier. The Department of Foreign Affairs for the Philippines has issued a public travel advisory, and Bermuda is on the list of countries that Filipinos cannot enter. Are you aware of this, and does it have anything to do with the CDC's incorrect recent classification of Bermuda as a level 3 high risk?
Thank you, Don. The answers to your question are no, I was not aware of this. However, given that you sent your question in advance, I did become aware of it. We haven't had a chance to look it up. Do you have any further information?
Yes.
Okay. I'll let the minister go,
Okay.
and then I'll speak to the U.S. side on the CDC and what's happening.
Actually, yeah, and I could yield to the Premier, because you'll see that they listed them. They're going by the same level of the CDC guidelines that incorrectly listed Bermuda at level 3. So if you look at that particular, the information that came from the Philippines, again, they're looking at the CDC level, but also it's interesting because they had Barbados, Bahamas, and Antigua and Bermuda listed as an area where you can travel, and they of course have clusters of cases, so they're not doing as well as we are in Bermuda. Not to compare ourselves to islands of the South, but unfortunately they have clusters of cases. So it is an interesting phenomenon that they're actually utilizing. I don't want to say incorrect data, but it is incorrect data, and it's the same listing of the CDC in which the Premier has spoken about, which we are desperately trying to have resolved and corrected.
The CDC listing creates problems, and I know that the Ministry of Health has been working with international organizations and helping to coordinate with Government House. There's two things in which they look at inside of there. It's the health capacity and also what happens inside of your country. Clearly, our health capacity is good. We've expanded our health capacity significantly to cope with any outbreaks which may happen on the island. And as I said, when we found out about this adjustment which happened last week, because the U.S. made a number of adjustments last week in August 6th, we reached out to, as was said, Government House, who manages our international affairs, to make contact with the United States through the United Kingdom's embassy in Washington, D.C., and also here through direct outreach to the U.S. consulate. As I had indicated in my remarks, I did receive communication from the U.S. Consul General, who said he is working on this. He has publicly praised Bermuda's testing regime and how safe it is here, and he is working to assist us in getting that level revised, and it is our expectation that we'll have good news to report next week. Why it makes a difference is because certain states will follow what is done at the national level, and for instance, level 3 will activate quarantine for travel to certain states, and certainly that's not something that we wish when we are looking to make sure that we have more and more visitors coming to our shores to support more and more of our hotels reopening, which they are, to provide more and more employment and economic activity in Bermuda. So it is something that we're watching. It is something we're working on. We were not familiar with that, but as the Minister of Health said, it seems tied to the United States CDC listing, and so we will push through that.
Thank you very much for both of you. My final question, Mr. Premier, as you mentioned earlier tonight, several countries that have had relapses after being in a good area. Another countries like the Faroe Islands, have a similar population size to Bermuda and have a fairly high tech economy. In the past few days, they went from 0 cases to hundreds, and they now have a transmission R value of 4, having dropped their guard against the virus months ago. That plus, as New Zealand, as you mentioned, what are the lessons for Bermuda from what has happened in the Faroe Islands and other similar jurisdictions?
Thank you. The lesson I would say in the first instance is don't drop your guard. And I think that we, through the Minister of Health, through myself, through the Minister of National Security, and others, we have been very consistent in that message. I do want to correct something which I had said earlier, because I've got a live update. I incorrectly mentioned the capital of New Zealand as Auckland. The capital of New Zealand is actually Wellington. Their largest city is Auckland, and that is the city of which is currently in this lockdown. But it shows that this virus can resurge, and it is a very, very contagious virus. So we cannot let our guard down. We are desperately wanting, to reduce the stress on the testing teams. Reduce the stress on the person at the airport, reduce the stress throughout. But we have to adjust to this new normal, not only from the perspective of how we interact, but also how our economy will function as we move forward. So from that perspective, people look at me and people are like, oh, you're so militant. Oh, you're always wearing a mask. Oh, there's no coronavirus around. Oh, we don't have any cases. Oh, why are we doing this? I was at an establishment last weekend, and some guy walked out and he was serious. Like, I need to talk to you. This is, I won't quote that word, but he was saying you can't do this, why are we still doing this? The fact is that it is because of us doing this that we're able to enjoy those freedoms. And we have seen for ourselves other countries who have not done as good as a job, places who have relaxed restrictions, places where they were afraid to say that you must wear masks when you go indoors, afraid to make sure they are enforcing these rules, etc. And that's not the attitude of which we've taken. So the lesson to be learned is, as I had said on many occasions, that we want Bermuda to be an example to the world on how you can successfully reopen your economy and manage the virus if you have good rules in place, excellent testing in place, excellent surveillance, as the Minister of Health has said, and I think we're doing that. And the lesson to be learned for all Bermudians is that this virus can come back, and we must continue the precautions and continue to shield and continue to practice those restrictions to make sure we keep our country safe, and most importantly, to make sure we protect the health of our economy.
All right. Thank you very much.
Good evening. Premier, you just indicated moments ago there's been 100 applicants for the residence policy applications. How many have been approved up to date?
Last week, Friday, that he'd approved 30. I haven't gone back to him to ask. I know what we've also done is that instead of just a standard you have been approved communication, which is automatically generated from the system, as I said earlier, we're doing more and more work on actually selling and making sure that we sell this product. So we are augmenting our sales job around it, because once someone applies, then you need to make sure that they actually come and are able to participate in the economy. And we're making sure that we can broaden the service providers of which they can use, refer them to the Airbnbs and other places which may be available for them to stay, etc.
It's unfortunate Minister Hayward's not here, but I'm going to ask you this next question. By all estimates, the island may have an excess of 3,500 persons applying for financial assistance. Many may or may not qualify for one reason or another. If that be the case, what would be the criteria by these persons who will then apply for extended unemployment benefits?
Thank you for asking the question, and I appreciate that. This was something that was considered in the cabinet on Tuesday regarding the announcement of the supplementary benefits, which the Minister of Labor had spoken to before. The first thing which I want to say, Trevor, which is very important, is for persons who find themselves needing assistance. Their unemployment benefits have run out. They need assistance. They must apply to financial assistance. Because the reason why that is in place is because financial assistance is set up to examine what the needs are, and they've been doing that for many, many years, and that is where the expertise in government lies. If persons are ineligible to receive financial assistance, such as they do need money and support because they're not working and they don't have savings, etc., but they're ineligible because they own a house or they own a car, what we have said is that we are not going to tell people that they need to start selling their houses and selling their cars during this period. So we've introduced a new supplemental employment benefit, which will be able to be made available to those persons who do not qualify for financial assistance directly, but need ongoing support. That was approved by the cabinet this Tuesday. The minister has said previously that persons must make sure they apply, and I want to make sure to remind all persons who are watching, who are nervous about how they're going to continue to provide for their families, the recognition that I have said that we're not going to let people go hungry in this country, and we are going to make sure that we provide for persons where there is a need for provision. But that is through the Department of Financial Assistance. What is key, however, is that it is not a blank check. It is not a blank check. And so persons who will be on those supplemental benefits will be enrolled in work deployment programs, and they will be given opportunities to rework when permits may be expiring, and there may be persons that are here to take those jobs. All of that process is going to work. And so the Ministry of Labor has workforce development, has immigration, has financial assistance. They're all inside the same ministry. They're all working together to ensure that process is as seamless as possible. And so in that, we have made that provision. It has been made very clear that we recognize that there are certain persons who may be ineligible for financial assistance because of their assets, but we are going to ensure that they exhaust all those opportunities. That may mean that persons who may not have made private pension withdrawals may be asked to do that, and then, you know, that's the process which financial assistance goes through, but it's important that that process is followed.
Thank you. Last week I asked about, as you had been the tourism minister, the update or the latest on hotels. You gave a little indication to your discussion this week. What is the latest situation with hotels, i.e. Elbow Beach, Southampton Princess, Hamilton Princess, our major hotels?
Thank you. Elbow Beach, I do not believe, I think on the Bermuda Tourism Authority website, it does state that Elbow Beach is not.
December 31st. They gave an indication about that.
Oh,
Have you been
yes.
in discussions with them?
Hold on one second, Trevor. Let me try and get the answer to your question. Stand by. I know that when it comes to the other hotels, so I can say that Fairmont, Southampton have not given an indication of an opening date, and they are listed on the Bermuda Tourism Authority website as to be determined insofar as their targeted opening dates. We do not have anything for Elbow Beach, but from the information that I have, I do not believe that they're expected to open before next tourism season. We were on calls both yesterday and today with Hamilton Princess and Beach Club. They are taking bookings. They are expected to reopen on August 24th. It is my understanding that they may not be opening with a full complement of staff, and there may be redundancies at that property. What is key is that we are making sure that we work with the Department of Labor, or sorry, the Minister of Labor is working with all of these businesses to ensure that our labor rules are followed, to ensure that layoffs happen in the way in which they should happen, if there are redundancies that are happening, to ensure that persons are getting the packages which are required under law, and we are going to continue to go with that process. But it is good news to know that more hotels have opened. We remember at the beginning of this pandemic, and when we started reopening, they were the owner of the reefs that said, it'll be difficult, but they have reopened. There's been success, as I had reported to you. Some tourism properties are now seeing more new bookings than they are seeing cancellations, and that is just a sign that the message is getting out that Bermuda is a safe place to visit, and we want to continue to build upon that success.
Are you aware, on another note, are you aware that JFK and Miami International will not be opening until they've changed their dates? I'm hearing September for Miami and possibly around the same time for JFK.
For American Airlines?
American Airlines, yeah.
I think that we reported that a couple of weeks ago, that American Airlines was planning on doing JFK, and not resuming Miami flights until December. And because I think that Delta is resuming out of JFK, and also JetBlue is resuming out of JFK, American Airlines switch to Miami starting in September and not doing the JFK service. That is my understanding. But these things are subject to change. Of course, it's 60-day notice for American Airlines for the changes in their schedule. Other airlines have 30-day notices, but we continue to work with our airline partners. We're thrilled at the airlift of which we have, and we're working to bring more online. And another thing that we've been sharing with our tourism partners is that we are continuing to work with British Airways on the move from Gatwick to Heathrow, and the move from Gatwick to Heathrow will certainly give better connections to expand opportunities for more European visitors to come to our shores. So we are hopeful that the work of which we continue to do is bearing fruit, and we see that it is bearing fruit with additional properties confirming their opening dates and looking to move forward to take advantage of the as well as our country has done in the management of this pandemic.
Thank you. For you, Minister of Education, my question comes from one of our viewers. What is the protocol for face masks when school reopens? One, bearing in mind that the diversity of face mask availability, will face masks be provided by the schools, or do parents have to provide for their students, their children?
Thank you for that question, Trevor, and it is one of the types of questions we get quite often. As I mentioned in my statement, the face mask policy will be all face masks must be worn during the entry and exit protocols. Face masks must be worn by middle school and senior school students within the building, as well as adults. In the primary schools, there will be situations that face masks will not be used, and there will be situations where they are used. But outside of the classroom, it's expected for all students to wear face masks on the few times that they're outside of the classroom. It is expected that parents will provide face masks for their children, but there will be disposable face masks at the schools for children who forget to bring theirs.
Thank you. And my final question, actually my second last question, for Minister Ming, National Security Minister. For inmates who have received hospital care while returning to Westgate, they are quarantined for 14 days in segregation. The officers who have stayed with these individuals at the hospital and transport them back and from to Westgate do not have to quarantine. Why is this?
Thank you for that question, Trevor. Actually, this was brought to my attention yesterday, and so we'll be working with the prisons to find out exactly what the protocols are with regards to the officers and the fact that the inmates are quarantined as well.
Thank you. And my Minister of Health, has there been any updates on one of my questions I've asked you from day one about the moonlighting one and the daycare for seniors' homes? Is there going to be a reinstating that option for some seniors that some was at Sylvia Richards during daycare service?
Okay, Trevor, under the, I don't have the act in front of me, but I believe it's the public health, it's one of the orders, public health COVID-19 2020 orders. The chief medical officer is allowed to effectively exempt persons from working from one particular facility to another. And the criteria now has been established where, based on the nature of the facility, so it's not traveling from person to person, it's the facility. And if a facility is able to demonstrate that they have sufficient supply of PPE, they have quality control measures, they have measures with respect to cleanliness, et cetera, then they can apply to the chief medical officer, Trevor, for an exemption to allow for a person to work at their home and perhaps another home. So the exemption, so the starting point under the regulations with respect to nursing homes is that you cannot work at multiple homes. Okay. However, you can apply for an exemption, but the application is for the home, not the person. And then secondly, with respect to your question concerning day facilities, daycare facilities. I actually believe, but I will confirm it because I know I owe you some more information about the travelers, that started a couple weeks ago, that they were allowing that. But I don't know, so let me get back to you about that with respect to if Sylvia Richardson, just so I know your specific question, has opened back up for day facilities.
Thank
Correct?
you. Thank you.
Okay.
My final question, Premier. We've been having these press conferences for 5 months. I'm not sure if you're aware that the numbers, your viewership numbers have dwindled. When will this segment come to a close?
Great question. Something that we've considered. I think that what is important is that people are continuing to get information, and we are continuing to give out the information which is required. So whether it's about the information which persons have to continue to adhere with, I know that there are a number of persons, if they're not watching live, then they'll get the information of which will come from the Minister of Education about school reopening. I know as a parent of a public school student, I want to know more about this information that's being shared. I know that there's a lot of persons who are anxious to hear information which came from the Cabinet Committee about the revised numbers of large groups, of which has been shared by the Minister of National Security and also the public health update. So clearly when the pandemic was in full throes and we were here daily and with the work of the media collectively with us, we were making sure to keep people informed. So I do not know how much longer these will last. There are conversations and discussions as to whether or not we should keep these up, but I think that it is important to get out the information. And so whether or not we're speaking about our economic recovery, whether or not we're speaking about the things that are necessary for persons to sustain themselves, whether it's the things which are happening on tourism, health inside of our community, et cetera, I think that it's important to continue to communicate with the people. And so from that aspect, we have not made any firm decisions, but we're examining what's the best way in order to inform people. There's one thing, however, I'm quite certain that you journalists would like to continue the opportunity to be able to ask questions and to make sure that we can provide your viewers with those answers. So I don't know, Trevor. I hope that you're not asking me to stop these press conferences, but we have been considering and discussed that internally, and we'll be making some announcements in the future.
Well, it's just a simple question. I mean, our ratings have increased. My TNN and the Honorable Premier's ratings have increased since we started, so I thank you.
I appreciate you. TNN understands, so I understand. Thank you. Everyone in Bermuda, thank you for your attention this evening. I know there was a lot of information to digest, and we've ran a little bit longer tonight, of which we normally do, but I wanted to make sure that we got as much information as possible. Certainly, we hear thunder outside, so I hope that that is excellent tank rain, as I know that there are many Bermudians who certainly need it. We'll be back with you next week, Thursday, with more updates, and I want to remind us that we must all continue to work together, not letting our guard down, so collectively we can continue to tell the story of Bermuda and our successful management of this pandemic. So with that, I would like to say thank you all and good evening, Bermuda.